Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Nick Schieda from the University of Ottawa, who is AJR's Genitourinary Imaging Section Editor. In this video, he'll be sharing with us his insights about publishing in this section. Nick, thanks for being here.
Thanks, Andy, for having me.
Can you tell us about your background in GU imaging?
Yeah, sure. So I've been a GU radiologist for over 10 years. My start in genitourinary imaging and imaging research is in large part due to the fact that I had a close friend who was a genitourinary pathologist who joined on staff at our institution at the same time that I became part of the faculty. So we had that synergy working together, and we often liaised for clinical questions, and then that kind of started our own research trajectory together, focusing on various genitourinary topics from testicle to kidney to prostate. Since then, I've been quite active in research in the genitourinary space. My focus is primarily these days on kidney and prostate intervention. I have a strong research background, and I've served as a reviewer or editor for numerous societies and journals, of course, most recently as the AJR section editor for genitourinary imaging. And people may not know that my wife is actually an MD, PhD, who's an epidemiologist. So I've learned from her and enhanced my statistical knowledge over the years, not formally, but informally through training by her, as well as my own research.
Great, thanks for sharing that with us. What trends have you observed for recent AJR submissions in GU?
So in my experience, I've noted that the quality of submissions have increased substantially. And I often joke that I would most likely not have the same number of publications that I do if I was starting off my career today than 10 years ago. What I've noticed is that papers that are submitted these days tend to have a more focus on standardization of methodology, assessment, statistical analysis. There's a very strong desire for high quality study design with less bias. And that can include larger patient populations, more cross-sectional study design as opposed to case control study design, use of multiple institutions, and involvement of more advanced statistical modeling or assessment to try to reduce bias.
So what do you see as areas of interest for publishing in GU over the coming year?
Definitely the areas of interest in GU pertain to existing or upcoming RADS systems, which are currently used in clinical practice or may fit a need for something with more standardization in clinical practice. So not necessarily proposing an entire RAD system from the scratch, but research into the framework that could potentially inform a RAD system, such as in kidney or testicle or adrenal, which is not existing, or contrarily, addressing gaps or weaknesses in RAD systems that are currently in use, like PIRADS, ORADS, VIRADS. So not necessarily trying to reinvent the wheel, but address parts of each system which may need or could benefit from improvement, or to provide a framework for future RADs. Moving away from RADs, I can see that a lot of the studies that are of higher interest focus on image quality, patient outcomes, and potentially cost effectiveness of imaging in certain clinical scenarios. And the last big one, I think, is, of course, artificial intelligence, but more broadly, moving away from use of radiomics in an exploratory way and more in a fashion where we can evaluate how AI could improve patient outcomes or particular diseases.
Yeah, it sounds like there's a lot of exciting stuff coming in GU. What tips do you have for authors looking to publish in the area in AJR?
So my number one tip for publishing in GU in AJR is to pick a strong research question, and a question that could advance clinical care. So not necessarily something groundbreaking, but something that could have a small but meaningful impact on current clinical care. So an example that I could give is studies that have and continue to evaluate PIRADS. Rather than trying to reinvent PIRADS or assess the system performance overall, many small studies have looked at certain aspects of PIRADS, such as the shape analysis of lesions in the transition zone and the peripheral zone, the use of upgrading rules, like size of 15 millimeters or presence of or absence of DCE enhancement in the peripheral zone, or more recently, the use of DWI to upgrade transition zone lesions. These are small studies, but they have incremental benefit and they have immediate impact in clinical practice. So these types of questions, though not necessarily large scale or groundbreaking, tend to be of strong interest to our readers.
And any common pitfalls that you're seeing across submissions?
So one of the pitfalls that we frequently see in our submissions are failing to have a strong research question. So a question that potentially lacks novelty or lacks immediate or downstream clinical impact. Those are aspects that we desire at AJR. So a strong and novel, if possible, research question is something that can be lacking in manuscripts that fail to go to review. In terms of manuscripts that get to review, so they have a strong research question, but they don't necessarily get over the bar to publication. One thing that we have noted is potentially a lack of a strong research protocol at the beginning. I can say that when I started my career, I never did a research protocol, and then gradually that moved to something a little bit more informal. And now I would not start a project unless we have a very strong research protocol from the outset, which covers everything from the study outcomes, defined in a granular way, the study team, the reference standard, the patient cohort, how it's going to be assembled, the study design, assessments performed by who, how, rigorously defining everything. And we've noted over the years that studies that potentially have not had a strong research protocol may have not identified a substantial limitation in a study that, though having merit and having a strong question, may not have been executed to the best possible way to get it over the bar and meet the high rigorous standards of AJR for publication.
And finally, anything else that you'd like for our authors to know?
Well, what I would really try to impress upon our authors and potential authors is to pick research questions that you're interested in. And that really comes through in the manuscript draft. So, we can tell which authors are really invested heavily in a particular topic and engaged in that topic. And so the questions are novel, they're impactful. The other thing is I would encourage authors to cast a wide net and to create a strong research team, both within your institution by involving other collaborators who may be experts in other imaging domains within your department, or surgeons or physicians in other departments who have an expertise in that particular topic, and also getting strong support from methodologists and the Method Center at your institution. More broadly, if you have a question that is lacking an adequate sample size at your institution, though it can be tedious and time-consuming, it may be in your best interest to reach out to other institutions and try to get a larger multi-institutional data set together, rather than going headstrong, knowing that there's a big limitation in your own internal data set, which may eventually limit publication of your study.
Nick, thanks so much for your service to AJR as section editor, and thanks for joining us today.
Thank you, Andy, for the opportunity.